Beautiful. Oh, we're good. All right, we're rolling.
Right. It is a universal human right that we be cared for and supported in the most skillful, compassionate, up-to-date, the techniques now, all sorts of medical developments have occurred, and people maybe misunderstand, they shut their minds to, they don't even realise that they're not accessing things that are available. But we do need to also look at dismantling or reducing the barriers.
I think there is so much opportunity to provide change for all of us, but I think that change will invite us to advocate and make changes towards advocacy and maybe develop a lived experience workforce within the palliative care space to provide different types of quality of care to those with lived experience.
The ACT is a very small jurisdiction and it covers fairly well. And the medical profession here certainly refers you to it. But I had a concern, and I think it's going to be a concern for the wider Australian community, is that once you're told you're going into palliative care, I certainly was left with the impression that the system just dropped you. And somebody from palliative care, ACT or New South Wales would be in touch, maybe. And depending on where you were, what their resources were like, was dependent on what sort of palliative care you got. And that's certainly not, in my mind, satisfactory.
If we're looking at one of the biggest issues for palliative care is remote and rural health and the Indigenous population. So that's where I think the concept of telehealth is a big opportunity, because then being for those people, health professionals and patients in the rural and remote areas know that there is somebody on the end of a line per se is important.
People are just frightened of palliative care. And they feel that consulting palliative care means that, the end is going to be very soon. And it may be, but, those last couple of weeks might be just the most incredible time that they spend with their family, or it may be a longer time. I'd love to see more people access palliative care, but I'd also love to see people understand what it is, so that they feel confident in accessing palliative care.
The opportunities are for everyone in the health system. I think palliative care needs to be embraced by everyone in an adult or a child's journey, because everyone has a role in it. One opportunity also is, once we introduce comfort to a patient, we improve their mental health, we improve their physical health. That doesn't just improve their journey, it improves the journey of the family and the carers around them. It also improves the experience of the medical professionals who are working with them. So that ocean, everyone's involved and everyone benefits.